So as we're talking about breathing easier with asthma, we really need to talk about who should be on the team of helping manage this whole process. And so tell us a little bit more about that, Nancy.
Well, it starts with the individual, so the individual that has asthma. So we want to empower individuals that do have asthma, even if they're children, to understand what asthma is, the importance of carrying their medication with them, the importance of knowing what their triggers are, and how to manage them. And also, an individual should participate in the asthma action plan.
Okay. So who else are there support people then?
Well, definitely the support person would be your physician or your healthcare provider. So that individual is going to be diagnosing that there is asthma. They're going to give you the medications and the prescriptions that you need to manage your asthma.
Okay.
They will participate in the asthma action plan. And the other thing that your physician and healthcare provider will do is to reassess how you're doing with your asthma and your medications, especially with children, about every 6 months or so.
That asthma action plan is really the core of everything about knowing the individual and how that fits, but who all should have a copy of that as part of the team?
The school, the coaches, anyone that is in the individual's orbit. The school has a responsibility specifically to participate in the asthma action plan, to know who has asthma in their school, and to make sure that their environment is asthma friendly.
Anybody else that should be a big player in this process?
Sure, everyone's a player when it comes to managing asthma. It's really not rocket science.
All right. Well, it sounds like if you have an asthma plan and you have a good team around you, you'll be breathing easier all the time. Thanks for tuning in and stay tuned.